All right, we are always working for you here. The Tennessee Department of Health is recommending that providers prioritize a COVID-19 treatment. They want them to follow the NIH guidelines for monoclonal antibody treatment, which prioritizes people who are most likely to be hospitalized.
Yeah, but before the state's recommendation, one unvaccinated Sumner County couple told us that they were denied back in August, and the husband says his wife was later hospitalized. News 4's Tosin Fakile talked to both of them.
The Hawkins, who were 64 and 63 years old, were unvaccinated and tested positive for COVID on August 15th. They went to Sumner Regional to get the monoclonal treatment, but they told me they were denied because they weren't old enough. And they say Mrs. Hawkins was later hospitalized for several days due to COVID.
I'm 64, my wife's 63. And they said you had to be 65 to get this.
Jim Hawkins said they went to get the monoclonal treatment at Sumner Regional after seeing a Tennessee Department of Health article on Facebook. After being denied, Hawkins said he sent a message to the Department of Health and got this response.
It was just confusing. We're just getting conflicting messages of this treatment. Anyway, my wife 2 days later went into the hospital for 5 days because of COVID, and they diagnosed her preliminary with COVID pneumonia.
We reached out to Sumner Regional to get answers. The hospital sent us this statement, which says in part that the hospital experienced an overwhelming increase of COVID-19 positive patients seeking care in August. It also went on to say that increase significantly depleted their supply of monoclonal antibody treatment. They said in an effort to allocate this therapy to patients with the greatest need, they temporarily implemented more stringent criteria for determining candidates for this therapy. I asked Jim Hawkins his thoughts on the Department of Health's new recommendation on prioritizing for the antibody treatment.
We would have fit that criteria. We were unvaccinated. We had COVID. We were pretty sick. They just told us that every hospital has different policies. We understand that, but the issue is that when you're sick, you're not going to go driving around hospital hunting.
I asked them today, and Jim Hawkins told me they do wish that they did get that COVID-19 vaccine. For News 4 Nashville, I'm Tosin Fakile.